Hey, CE Impact subscribers, welcome to the GameChangers Clinical Conversations podcast. I'm your host, Josh Kinsey, and as always, I'm excited about our conversation today. Acetaminophen is one of the most widely used medications during pregnancy, yet recent studies have raised questions about its potential links to autism and ADHD. In this episode, we'll explore the FDA's latest response alongside key research findings to better understand what the evidence does and does not tell us. And it is great to have John Swegle with us again for our guest today. John, welcome. Thanks for coming back to us today.
Thank you, Josh. It's always a privilege of mine to join you guys on these podcasts.
Well, thank you. So for those of you that may be new listeners, perhaps you haven't heard John as our guest before. It's been, I don't know, we were talking maybe 6 or 7 months since the last time you were on. So just for those listeners that may not know you yet, go ahead and give us a rundown of who you are, what you do, and why you're passionate about pharmacy practice.
Absolutely, Josh. Happy to do so. So yeah, I'm John Swegle. I am a pharmacist. I went to school at Drake in the University of Iowa, and I practice up in Mason City, Iowa. I'm a pharmacist for a family medicine residency program, and I am fortunate enough to work with a bunch of physicians caring for patients in the inpatient, outpatient, and the nursing home setting. We in family medicine, of course, deal quite a bit with obstetrics as well as part of the training. I also work with the College of Pharmacy at the University of Iowa, where I'm a faculty member down there, and so I am privileged enough to be able to teach and precept students, and been doing this up here now for 28 years. So that's a little bit about me.
Yeah, awesome. Well, thank you again. I know you're super busy. This is a busy time of the year. I remember fall in academia is always just, I feel like, just nonstop. So thanks again for giving us your time this afternoon. So as previously mentioned, our plan for today is to discuss a topic that has been in the headlines recently. So as our listeners will recall, the FDA's response to research exploring possible links between acetaminophen use during pregnancy and neurodevelopmental outcomes like autism and wow, I'm going to mess that one up. ADHD, that was a mouthful. Autism and ADHD. Again, on September 22nd, 2025, the FDA announced that it will add new labeling to acetaminophen products, noting evidence of a possible association between prenatal use and neurodevelopment outcomes. Notably, the agency emphasized that these findings demonstrate correlation, not causation, and that untreated fever during pregnancy can also pose risks. So acetaminophen may still be appropriate when clinically needed under medical guidance. So we're going to be digging into some studies today, John, but before we do that, can you help us maybe put into layman's terms, perhaps, the FDA's position on this? What exactly were they saying in their announcement a few weeks ago?
Yeah, for sure, Josh. So the FDA obviously has responsibilities for looking out for safety and efficacy of medications. And in light of studies that have come out recently, I think that the FDA probably felt the need to share a little information in light of all those studies. And so they are, again, as Josh, as you mentioned, talked about an association of an increased risk of the neurologic conditions such as autism and ADHD in children. And the FDA is sort of citing the studies which are pointing out that the risk may be most pronounced when acetaminophen is taken chronically during pregnancy. And that's a very important point, I think, that the listeners need to know.
For sure.
And they are also pointing out that there is not a causal relationship that's been established, and there's contrary literature out there. And so the FDA is basically wanting to just, again, in the spirit of patient safety and prudent medicine, as they put it, they want clinicians to try to minimize the use of acetaminophen during pregnancy. And I would argue that we already do that, but I think the FDA just wants to reassure that patients and clinicians are not overusing acetaminophen or any medication for that matter. But the FDA also points out that the fact that acetaminophen is the safest of the over-the-counter alternatives, and so we don't have anything else really that is safer than acetaminophen as far as treating things like pain and fever and so on. So that's where the FDA kind of stands.
Yeah, and as they mentioned too in the statement that they acknowledge that an untreated fever during pregnancy can also pose extreme risks to both the mother and the child, right? So there, again, it's kind of going to be one of those things that best discussed with medical providers, and pharmacist is in play here. So that's really why we want to be sure that we're talking about it from our perspective as well, because inevitably you're going to have patients ask you questions about this now. And so we want to be sure that you know the facts and know a good response for them.
Yep.
So let's dig into the first study. So there were two specific studies, I think, that are kind of linked to the FDA's recent announcement. And so the first one we're going to look at was a study from 2019. It looked at acetaminophen use reported during pregnancy and compared it to the use before and after. So John, I'll turn it over to you to kind of talk a little bit about this study and kind of give us the rundown as to why this one's being used for guidance in these recent developments and statements.
Yeah, absolutely, Josh. And I want to point out to the listeners that we don't have any randomized controlled trials on this. And we're not going to probably have a randomized controlled trial of pregnant women using acetaminophen and then following them for many years. So what we're left with then are what some people refer to as kind of these messy observational studies. And as a result of that, we don't have any definitive data. And so the study that you're talking about, Josh, from 2019, when you have associations, you always are going to have these variables, and you try to tie a variable with a cause, or potentially a cause to an outcome. The challenge with that is that you have to control the other variables that can also have an impact. And that's what this trial tried to do. They did what they call the negative control exposure, which really is designed to try and assess and correct for unmeasured confounding bias and basically help to strengthen a causal claim regarding a primary exposure. And that was sort of the design that they had used. And this trial specifically was looking at acetaminophen exposure and ADHD. And they had 110,000 plus female nurses that they were giving questionnaires or surveys every other year for a number of years. And one of those questions that they had asked is about using acetaminophen, specifically regular use of acetaminophen. And so when they're talking about regular acetaminophen use, they are also using that term as use at the time of pregnancy. So it's very, very interesting in how they put this together. But what they found is that in those nurses that regularly used acetaminophen during the time of pregnancy, there was an association with an elevated odds of ADHD developing in the offspring. And that's all fine and dandy, but that type of a trial does have some limitations, and I think that those are important to point out. One of which is that this study cannot rule out what's considered residual confounding. And basically, there's always a persistent bias that is involved, and you always will have unknown confounders which are not accounted for. And this survey was an example of something that probably had some of those unknown confounders. There was no details about the exact timing of acetaminophen, and that's important. We didn't have any details on the frequency of how often they used it or what the dose was that they had used.
That's what I was going to ask. Was you said earlier that it was based on use? Was that ever defined? So
nope, regular use is the terminology that they said,
Interesting.
and so that could mean daily use, that could mean every week, that could mean 4 times a day. They did not define that, and that's an important point to look at.
Yeah, for sure.
And the other limitation, really, again, these are surveys, right? So there's always a potential for recall bias, if there is, looking back in time. But the diagnosis of ADHD, that was also self-reported by the mothers. So that's a potential limitation as well with that particular study.
So there was no follow-up to see if there was an actual diagnosis of ADHD in their offspring.
Correct.
Okay. Interesting. Yeah, very interesting. Yeah, I mean, so it sounds like it has merit to stand on, but also potentially some limitations that we need to take into consideration. So
yep, yeah, absolutely.
Was there anything else on this study that you wanted to highlight or point out?
No, not really. It's
Okay.
it's it's an example of, there's other studies out there that are probably similar to this,
Hmm.
but nonetheless, there's not a whole lot more to this study. I don't think that needs
Okay.
to be highlighted.
Okay, so then we'll jump to the second study that was kind of that we've chosen to highlight, and that was, kind of again the basis for this. It was conducted in 2020, and it employed a different approach than the one we previously just talked about, where it utilizes biomarkers from umbilical cord blood to assess exposure to acetaminophen. So that sounds like an interesting setup, and I don't know whoever came up with that. So, but I'll turn it over to you, John, to talk a little bit about that study and how it was designed and what kind of the outcomes were.
Absolutely. So this, yeah, you're right, Josh. It's looking at cord plasma metabolites of acetaminophen is what they were doing with this one.
Yeah,
And
very
part of the
interesting.
reason, yeah, exactly. And part of the reason for that they figured is that the acetaminophen can remain in the infant circulation for longer periods of time.
Mm,
And so what they did is they took, 990 or so mother-infant dyads at Boston Medical Center that had cord plasma samples from metabolite assays, and the final sample had about 226 kids in it. And the intent of doing it this way is now you have a direct measure of acetaminophen exposure
mm,
rather than maternal self-reporting. And so that's a different twist to this. And that's a good thing because now you're taking that recall bias part out as well. But they were looking for a link between acetaminophen exposure and ADHD and autism spectrum disorders. And they did find a positive association between cord acetaminophen and ADHD and ASD. And they also, and this is an important point too, they also noted there was a dose response pattern to this, which a lot of studies have kind of come out and said, the higher the dose, the more the exposure, the stronger the association.
mm, mm-hmm.
Like all studies, there are limitations, right?
Sure.
This one, it was just a one-time cord measurement. That's all they took. And the interesting thing too is that that the levels there may actually reflect the maternal use of acetaminophen during that peripartum period. And there was no non-exposed group as a reference, so they didn't really have a reference to go by. And the other thing, and this arguably is one of the most important things, they were not able to exclude potential confounders, specifically genetics or environmental factors. And that's a very important limitation
Mm-hmm.
that we'll get into here in just a bit, but those were
Yep.
limitations with this study as well.
Yeah. One thing I find interesting in that, well, let me clarify too. So, what if as the mother got closer to birth,
Hmm.
she took more, and so
Right.
like, wouldn't that show more of the metabolites then? So is it really indicative of how much was happening throughout pregnancy, or is it really just kind of like right before birth? Does that make sense?
Yeah, that's a great question, and that's one of the limitations they had because clearly, do we use Tylenol a lot in moms in labor? Well, we'll probably step it up a notch or two,
Sure.
but certainly they could use it, right? And
Hmm.
so that's a great question, and I don't know that they necessarily addressed that
Got
because
it.
again, they're just looking at cord measurements,
Mm.
and so I'm not aware of them looking at how long the mom had used acetaminophen. They used it
Right.
throughout the entire pregnancy versus, like you're pointing out, Josh, closer to time of
Immediately
delivery where they
prior.
might
Yeah.
need something more. Yep,
Yeah.
absolutely.
Yeah. Okay. Interesting. Okay, so then, so those were kind of the two, I guess you would say, supporting studies. And then there is one that we're going to highlight, which we would, I guess, maybe consider a contrasting evidence or a contrasting study. So several large studies, such as one in particular that we're going to look at, such as a Swedish sibling analysis, have found little to no association once genetic and family factors are controlled for. How do we reconcile findings that seem to point in different directions like this?
Yeah, so yeah, it's so
Is that a
interesting.
loaded question?
Absolutely, absolutely. I want to just kind of jump in with this whole autism diagnosis thing, and the reason I want to do that is we know that the rates of autism are increasing, and so the
Mhm.
question is why.
Right.
Everyone wants to know why, but we can't help but think also that part of the reason that we have an increase is probably due to the fact that we have more public awareness about autism.
Awareness. Yeah,
We
for
have
sure.
more expanded screening for autism, and we also have improved diagnostic methods
Mm.
for autism diagnosis. And so that does play a role. And so the cause, and this is the genetic part, Josh. This is fascinating. So the cause for autism, what causes it, and that
Mhm.
it's so complex that it's hard to pinpoint. But there is a general consensus that genetics is involved. Okay,
Mhm.
and part of the problem with that, because these genes and mutations that are central to brain function, there's hundreds of genes
Right.
that potentially could be linked to autism, and you probably have some environmental play in that as well.
Mhm.
So those are things that the genetic component is vitally important, which gets us back to the study that you're referring to with which was conducted in Sweden, and this came out in JAMA in 2024.
Mhm.
And there's a one earlier too in 2021 that also looked at a genetic link. And the interesting thing about the JAMA one is that this actually was replicated in a Japanese population and came out with the same results.
Oh,
Okay.
wow. Okay.
Yeah, exactly. Very, very interesting. So what they did is they did what they called sibling control analysis. And so this study, they did two separate things. Okay. First thing that they did was they looked at children born to mothers who used acetaminophen during pregnancy, and they compared them to children born to mothers who didn't use acetaminophen. And what they saw with that was this apparent association between acetaminophen use and risk of autism, ADHD, and intellectual disability. Okay. But then they said, okay, well, what if we did this sibling thing where they did the comparison? So what they did basically is they had kids that with the same parents, siblings, where one was exposed to acetaminophen in the womb and one was not. And when they reran the analysis, all those associations disappeared.
Mm.
So what they are saying is that that's probably a genetic component that was
Mhm.
not captured in a lot of other studies. And this was in like 2.4 million kids
Wow.
that were followed over time.
Yeah.
So both this study in JAMA and the one that came out in 2021 that did use the sibling control analysis, neither one showed an association. And arguably, these are more methodologically sound studies.
Mm.
But that's what this one found, and that's sometimes I think that we always want to find the answer. We probably will never find a true answer, but using
Right.
studies like this, I think kind of goes against some of the earlier studies we had talked about.
Right. So just to reiterate and make it clear to make sure that I'm fully understanding. Um, so basically in this most recent study with the sibling analysis, one sibling was confirmed exposed to acetaminophen, one was not. And when they ran those again, there was no correlation to an increase in autism or ADHD or other neurodevelopment diagnoses. And so therefore it wasn't linked to acetaminophen, or that's the idea. It was more of a genetic cause. Okay.
Correct. Correct.
Okay.
And that's sort of the trend that they're finding, that when you
Gotcha.
do these sibling analysis, the data that uses those tends to not find any evidence supporting a causal association.
Interesting. One thing I thought of, and this is random, and you may not, I may be putting you on the spot here again with another question. Apologies if so. But do you know what sparked the interest in acetaminophen in general? Like clearly if there are all these studies that have been going on for the last almost decade, maybe, like what was the initial spark of, oh, you know what? I bet it's acetaminophen. Or was that ever the case, or did they just stumble upon it? Do you know the answer to that at all?
Well, I know that for I think part of it is that we've been using acetaminophen in pregnancy, thinking it's safe for decades, right?
Sure.
And then you have
Mm-hmm.
autism rates that just keep going up, and so you're looking for why is that, and is there any exposure? We went through this with
Got
immunizations,
it.
as you know. Interestingly enough, back in 2015, the FDA reviewed available data, and they did not find evidence to be, what they found is that all the evidence was inconclusive. The Society for Maternal Fetal Medicine in 2017 also looked at the data, and they reached the same conclusion. So,
Mm-hmm.
yeah, this has been looked at over and over and over again. And I think when you have Some studies say there is potentially an association. Some studies say there isn't. That tends to lead to more studies to see if we can't get a better answer.
Fair point. Yep, fair point. Yeah, so that makes sense because I was just wondering why we zeroed in on acetaminophen in the last decade. But as you said, it's because it's been a common medication that pregnant women take. So that would make sense that we would look to it as a potential culprit. So yeah. Okay, so let's get into what I would like to, well, what I find more interesting. I've never been super good at or excited about digging into studies and breaking them apart, but you did such a great job and put it on a level that we all can understand, so thank you. But really what I want to dig into are, what are these practical implications? Like, what does this mean for pharmacists in everyday practice? We are going to have questions asked of us. We are going to have family members ask questions of us, and we need to know, an appropriate response that is evidence-based. So right now, just kind of restating a fact, acetaminophen is still the only over-the-counter pain and fever reducer that's generally considered appropriate use during pregnancy. So if we're cautious about its use, what realistic alternatives would patients and providers have? So if we take this information and really are overzealous and cautious on it, what are the options? Is there anything out there?
Yeah, that's always a great question, right? So we know NSAIDs are out.
Mm-hmm.
They just are. I mean, they've been
Mm-hmm.
associated with fetal risks, miscarriage, kidney defects, premature closure of ductus arteriosus, all that sort of thing.
Yep.
So NSAIDs are out.
Mm-hmm.
We're obviously not going to want to use anything more strong, I guess, for lack of a better
Yeah.
description, like opioids, things like that.
Mm-hmm.
There are, and a lot of people advocate, and this is funny you mentioned this because you're seeing things coming out over and over and over again. And I got something sent to me 45 minutes ago before this started.
Oh, wow.
Talking about what do we do? But the stepwise approach is always a good thing to do. So if we can do non-pharmacologic things, hot packs, cold packs, stretching, physical therapy, things like that, for example, for pain, those are certainly viable approaches. OTC things like with menthol or lidocaine are probably going to be okay, not salicylate containing products and things like that.
Sure.
But then you have, arguably the one that is potentially the safest, that's acetaminophen. That's just something that we still are going to be using. And so,
Right.
When patients come in, we have a general rule, right? With any pregnant woman, we don't want to expose anybody to medications that are not necessary. And so the general rule is the lowest dose for the shortest time. And so if patients come in saying, I have a headache that is just really bothering me, or if somebody comes in and they have a fever, well, we don't want to let those just go.
Right.
Don't just ignore them.
Right.
And so it's better to, and we can talk more about the risks that are associated with those if you want to, but it's definitely better to treat those with acetaminophen than not treat them based on a theoretical risk.
Right. And that's a great segue to go right into those, because that was one of my next questions is, there are conditions like fever and severe pain that, if left untreated, also pose an extreme risk to the pregnant patient and the baby. And, as far as even birth issues, as well as miscarriages, right? So those kind of things can have severe negative outcomes as well.
Oh, for sure. I mean, these are known. Okay, these are
Yeah.
known. So fever, for example, fever is associated, and high fevers are associated with increased risk of neural tube defects, increased risks of miscarriage, premature birth. There's some link as well to oral clefts and cardiac defects with fevers. Pain in and of itself. Pain can cause destabilization of maternal physiology, which can lead to depression, which can lead to anxiety, which can lead to high blood pressure. And all of those can have potentially negative effects on fetal well-being.
Sure.
So
Sure.
those are known. And so we can't just ignore them and say, no, you're going to be fine. Just don't take anything. We don't want that to happen. So please, the listeners, please don't just let those go. We need to do something to help reduce those known risks associated with those.
And I like your approach, as you mentioned earlier, where the non-pharmacologic approach is first, trying, like you said, stretching, recommending potentially, or yoga aerobic classes or something that is getting, more exercise and more flow of blood and everything like that. And then using the acetaminophen as kind of, I hate to say last resort because it's not really what we're going for, but using it as the backup, as the option, but not always as the go-to, I guess. So,
Right, right. I don't think a pill is always the answer for everything. And
correct.
that's true outside of pregnancy
In
too.
general, yeah, I mean that's I always find it funny because a lot of friends who are not pharmacists, a lot of our friends are pharmacists, but because my husband and I are both pharmacists, but kind of keep that circle. But a lot of our friends that aren't, they always, talk about, oh, you're the pill pushers, you're the ones that, and I always, you know, get back and say that's we don't always love a pill for fixing things, like that's kind of a second or third option. So I think just keeping that in line here as well, just realizing that there are other options that we can use before we resort to that, unless, as we stated, super high fever or something like that, which it's
Correct.
going to require that treatment, to get under control.
Absolutely.
Um, so how should we handle patient concerns when we're approached? Any specific tips or tricks for counseling or not, I don't want to say like squashing their fears, but you know what I mean? Like what can we relay to them to where, yes, I understand all of the facts. Here is what our plan is, and maybe it's just as simple as that.
Well,
So,
that's a great question, Josh. I just have to throw in there because we humans and people with social media and all the
oh
links
yes.
that are out there, it's tough and for pharmacists to make recommendations when they can point to something they read on some link somewhere that
Hmm.
somebody said.
Hmm.
And all of us have gone through that, right?
Oh, for sure.
All of us have battled that one. And so it does make it tricky on what do we say to these patients.
Hmm.
My advice is I feel that at this point in time, with the evidence that we have, acetaminophen, and even the FDA says this, acetaminophen is still considered the safest of the options out there for treating pain and fever.
Hmm.
I would also back that up. There are two large governing bodies that deal in this, and one of which is the American College of Obstetrics and Gynecology, or ACOG. Their opinion on this is that the weight of evidence right now does not support a causal link, and there's no change in clinical practice that's warranted at this time.
Mm.
The other huge governing body is the Society for Maternal Fetal Medicine. So these are the specialists in this area.
Hmm.
Their point is you cannot just ignore untreated fever and pain during pregnancy.
Right,
And the
right.
association at this point in time is considered simply inconclusive. So as a pharmacist, if I'm educating patients on can you take acetaminophen for your fever, for pain, obviously we want to limit the amount that you take. Yes, 100% agree with that. Again, lowest dose, shortest period of time.
Hmm.
I would trust the opinions of those governing bodies that specialize in obstetrics and
Yeah,
what their statements are.
yeah.
And there are other organizations too.
That are
I don't
supporting
want
that.
to
Yeah, for
exclude
sure.
people, but
Yeah,
these are the two big ones in
sure,
the world of obstetrics and gynecology.
sure. So I think that if we were to summarize this in a sentence, which would be impossible or potentially even damaging to do, but if we were to summarize this in a sentence, the outcome is be cautious, but don't boycott the use of it, right? Like this is
Correct.
this is not a throw it out the window, never to be used again under any circumstance. It's more of a question the intent, make sure that, non-pharmacologic options have been used, and then use it in emergency situations like high fever and extreme pain. So,
Yes, and I want people to know that. I mean, it is at this point in time the safest, like the FDA says too. It is the safest option we have.
exactly, exactly.
We don't want to expose people to things we don't need to expose them to. But if they need
Right.
it, it's a risk benefit thing, and right now the benefits are there, and we
Yep.
know that. So yes.
Makes sense. So one last question, John. So looking ahead, um, what kinds of studies or methods do you think would help us move closer to answering whether there is a true causal relationship here between acetaminophen and autism and other neurodevelopment disorders.
Yeah, short of a randomized controlled trial,
Right.
establishing causation
Yeah.
is next to impossible, right?
Right.
So,
Yep.
and we're not going to have that. And so my thought is that we're going to continue probably having studies coming out that some might say that there is an association. Some may say that there isn't. I do think that the studies that do look at the sibling controlled aspect of things and sibling analysis to try to capture that genetic component, which is vitally important in this. I think if we had more of those studies and have them be sort of prospective, but more in real time to help eliminate some of the other biases that are out there, other confounders that are out there,
Yep.
I think that would be helpful. But
Yeah.
I don't know if we're ever going to find a definitive answer without, for causation at least, without a prospective study. I just don't know that we're going to be able to do that.
Yep, makes sense. So again, as just in summary, I think one of the biggest take-home points for our listeners today is to stay vigilant, remain up to date with information that's coming out, and be sure that your recommendations to patients are always evidence-based, and that you are, I love what you've said, and you've said it a few times, lowest dose possible for the shortest amount of time to get the job done. So I think that's great advice, take home for our listeners today. John, anything else that you'd like to share?
No, I mean, this has been great, Josh. It's a very hot topic, and there's a lot of information out there. But I appreciate the opportunity to come by and share my thoughts with you and look at what's out there for the literature. And
Yeah.
But yeah, thank you very much for the opportunity.
Thank you. Super helpful to have someone who can dig in and give us that journalist perspective. So we really appreciate it. So again, key takeaway for our listeners is that the FDA is carefully reviewing additional evidence. The associations are not proof of causation, and patients should always discuss pain or fever management during pregnancy with their healthcare provider. And remember, pharmacists are healthcare providers. So be ready for those questions, and we want you to stay up to date and to stay focused on the evidence that's out there. So thanks again, John, for joining me. We really appreciate it.
Absolutely. My pleasure.
If you're a CE Plan subscriber, be sure to claim your CE credit for this episode of Game Changers by logging in at ceimpact.com. And as always, have a great week and keep learning. We can't wait to dig into another game-changing topic with you all next week.